First of all, thank you so much for this large turnout. We are really excited to share with our community some great news. First of all, I wanted to let you know that I'm Carol Price, and this morning I want to talk to you a little bit about Healthy Communities of Clinton County. It's a coalition of people and healthcare providers, service organizations, education, all kinds of people who are just interested in making the people of Clinton County healthier. And we've done that in many ways. We've had some successes, such as we've been able to receive a grant through the Indiana Minority Health Coalition. We've received a grant from the Indiana Tobacco Prevention Cessation. We've received a grant from the Indiana State Department of Health with asthma, for our asthma education program. And we've done other things with obesity, have our own program about obesity and physical fitness. We've created some walking paths, and we're going to be celebrating a wonderful brochure this summer with all of you, and we hope all this many people will come walking with us. So, but this morning, I'd like to tell you about a really big celebration. Our community has been selected to receive the Achieve grant. This is through the National Association of Chronic Diseases. There are 4 ways that you can apply for this grant. One is through the National Association of Chronic Diseases, and one is through the National Association of Health Offices. One is through the YUSA, and one is through the National Association of Parks and Recreation. We have been chosen one of 40 communities in the United States. It's okay to clap now. I think part of the reason that there's probably 2 reasons why we were chosen for this grant. One, we do have plenty of health issues here in Clinton County, in Frankfort. We do have plenty of issues. But the other, more important part is that we have a wonderful collaboration of people in Clinton County who are interested in working on the issues. They're always trying to come up with ways to change things, to improve things, whether that be through programming or policy. Everything we have done has touched the lives. I'd like to point out our banner, and the part I love the most is touching people's lives every day in schools, work sites, healthcare sites, and other community settings. And our coalition has done just that. So we're very, very excited about that. I would like at this time to ask Dr. Gregory Larkin, our State Health Commissioner, to come forward, and I have a presentation for him. Congratulations. We are pleased to bring this distinction to the state of Indiana for you.
Thank you very much, and this is a truly unique honor to be part of your celebration. I wish I could go to 91 other counties and have a similar celebration, but it ain't going to happen. Because what you've done here is truly unique. You have been able to partner broadly within your community, reach out to many partners with the help of Purdue Extension and others, and actually formulate a plan that's going to address what are your most significant health issues. Not only your significant health issues, but those of the state of Indiana. Chronic disease is a significant burden, not to the nation and to Indiana. We lead in a lot of things we wish we weren't even in the race for. For instance, tobacco usage and obesity and perhaps lack of exercise. But what we understand in public health is that the only way you're going to improve those outcomes, the only way you're going to perhaps lower the incidence of overweight or tobacco usage and control hypertension and cholesterol is a community solution. A physician can't do it him or herself. It isn't one restaurant who's at fault or one vendor. It takes a community solution to look at the book of business of the health of your community and sit down in partnership and understand how we as a community, be it the Y, be it the church, be it the school, be it the restaurants, be it whomever you include in that network, how can we make our community healthier? And that may be what you do with your school system, it may be what you do with your exercise pass, which you've already cited, it may be with a lot of general good policy that makes good health choices easier than the difficult ones. And as I talk about the rate of obesity, I always say it's going to be a heavy lift to change it, and it always sounds like the world's worst pun. But we do have a lot of issues, and they're all tied in together, be it diabetes, cardiovascular disease. They're all related to nutrition and exercise. We just released a 10-year plan that's been very thoughtfully put together for the state that talks about things communities can do. But you are on the front edge now. You have been one of 40 cities in the United States, or 40 coalitions in the United States. I mean, that is really, really stellar, and I think you should applaud again. 'Cause I think so, thank you very much for inviting me and my staff to attend. I know our component of chronic disease at the state has been very engaged and helpful, and glad to be part of this. And like I said, I hope in my tenure I will have the chance to visit other communities that have shown the leadership you have. Thank you.
Thank you. I'm going to put him to work. We're going to. I wanted to recognize some other people, some of our partners today, and so you'll have an opportunity to get your picture taken with Dr. Larkin. Yeah, that's a good thing. First of all, Tom Crawford, would you come forward? Tom is the administrator of St. Vincent Frankfort Hospital, and St. Vincent Frankfort Hospital has served as our lead agent and our physical agent, and we really appreciate the partnership that you provided for us, Tom. Susan Tharp? Susan is the CED at the Purdue Extension in Clinton County, and Susan, we really want to thank you for the initiative and all the hard work you've done through the many years that the coalition has been working, and we appreciate it very much.
Thank you. A little bit about the background here, and thank you. Healthy Communities of Clinton County was developed in a response to an initiative that was encouraged by the Indiana State Department of Health in cooperation with Purdue University. And after a comprehensive needs assessment, which we spent days and days and days going through this needs assessment about 5 years ago, we were asked to identify, first of all, something that we could do really fast that would have measurable outcomes, and then secondly, long-term goals. And so the thing that we identified as the short-term one was the hand washing, which maybe you saw at the middle school and then at Clinton Central, and now if you notice at the Clinton County Fair, a lot of other places, there are now hand washing stations. So the idea is that the education spreads. Other significant risk findings that needed more long-term interventions included the three that we picked: obesity, not that we picked, that we identified through the obesity, smoking, and health access, especially for non-English residents. So 5 years ago, Extension brought together several partners to begin the work of developing the Healthy Communities of Clinton County. Get Fit Clinton County was the signature program of the obesity component. A new ITPC, Indiana Tobacco Prevention Coalition, was established and developed, and a new Minority Health Coalition was formed, and all received funding for coordination for local initiatives. So thank you for all of the partners, and now the partners have spread, and there's a lot more. And thank you to all the partners, and you'll be hearing some more that have helped make this possible. But I thought I'd give you just a little history.
Yeah.
Thank you.
It's great. Susan is co-chair of the coalition along with Kelly Peisker. Kelly works for St. Vincent Health in Indianapolis, but she spends a lot of time in Clinton County. She is helping us. She probably works harder than some of our citizens. Thank you, Kelly.
Thanks. Thank you very much.
Is Barbara Lucas here? No. I wanted to give a certificate to the Indiana State Health Department asthma program. Barbara Lucas and I have been emailing each other back and forth for months now, but we've never actually seen each other. So she could be here and I wouldn't know it. So, Amy, would you take this back to her?
Sure.
And you can get your picture taken with Dr. Larkin.
Oh my goodness. Thank you, Dr. Larkin.
You're welcome.
And before you go back, Amy, I also wanted to give one for the Indiana Tobacco Prevention and Cessation. They are also one of our partners and support our program, and I don't think anyone from their office is here either. So,
Sure. I will take that back to them too. They'll be very happy to have
great.
that. Thank you.
Thank you. I'd like to call Davina, how do you say your last name, Johnny? Johnny.
It just looks fancy.
Okay, looks fancy. Davina Johnny, who is the director for the Indiana Minority Health Coalition, and we are so grateful to have your support here in Clinton County.
Thank you. I'm actually just a field consultant. I don't want to take that big responsibility.
Oh, okay.
Well, you're welcome.
And our local coalition director is Claudia Houchin. Would you stand so people know who you are? Claudia does a wonderful job bringing health issues that help our Hispanic residents and other minorities that we have here. She's done phenomenal with that. Thank you, Claudia. At this time, I'd like to recognize our county commissioners. The reason I want to recognize the county commissioners is because, congratulations, you now represent a county where there's an achieved community. This is Mike Beard. He's the president of the commissioners, I think.
Thank you.
And pictures. Skip Evans. Another one of our county commissioners. We thank you so much.
Thank you.
And Bill Beard. Thank you, Bill, for all your years of service.
Thank you.
And next, I would like to present the same award to Shan Sheridan, who is our Chamber of Commerce Director and Community Economic Development Director. Shan, you now have one more tool to bring people to our community for business.
All right, thank you very much.
And last but not least, this award is for Cindy Zenkert Strange, who helped write this grant. Thank you, Cindy.
They normally just put me back in a room and get me working on the next one.
Okay. And Tom Crawford has something else that he would like to share with us.
Well, I was remiss in my duties when I was up here earlier. A highlight of my day is I get to be Dr. Stephen Tharp today, so I never want to give up
That's
a
right.
chance to do that.
right.
But Steve he could not be here today, and he wanted to offer these thoughts. It's my pleasure as Clinton County Health Officer to congratulate Frankfort, Clinton County, and healthy communities of Clinton County on earning the Achieve Grant from the Centers for Disease Control and Prevention. This award is well-deserved. It's well-deserved fruit from countless hours of hard work and service to our community, advocating for weight loss to reduce obesity, walkways to encourage healthy activity, promoting a smoke-free environment, and improving healthcare access for minorities. By awarding this grant, the CDC has entrusted us with the future of our community and has given us a tremendous jump start towards looking at a brighter future. While it will be a challenge to make good on the promises we established today, I know that teamwork exhibited so far will put our community on the road to a healthy and prosperous future. From Dr. Tharp.
Thank you, Dr. Tharp. I think you might have shrunk a little bit. Anyway, and that almost concludes our program today. I would like to introduce to you one more person. This person, because our award was through the National Association of Chronic Diseases, they have a component that we get a new team member, not from our community, and that is Jo Beth McCarthy. Jean, would you step forward so people can see you? This is going to be my new best friend. Jo Beth and Susan and I are going to Atlanta together to begin this whole process of getting the training that we can bring back to our community. So we're really excited.
Congratulations.
Thank you. So her title is Expert Advisor. Jo Beth, do you know that? Your title is Expert Advisor.
Yes.
All right. All right. And so
Serve you well.
and we're very excited about having you help us. I'm not sure if there's other people that I should have introduced that I didn't introduce. If there are, I'm really sorry. I would like to introduce a few people that are here that I can see. And if I can't see you, step out in front of me. Steve Fry is a county councilman. Jim Moyer is a city councilman. You guys wave. Okay. Ron Kelly Where's Ron? Ron Kelly is its CEO at Wesley Manor, who is also one of our partners. Leah Borntrager comes to our coalition meetings all the time. She is the wellness director at Wesley Manor. So when I say that the coalition worries about health from babies to old people, we do. Let's see, who else is missing? Sorry? Oh, Steve Wood, County Council? I can't see you. I'm just kind of looking around. So again, I am so glad you're all here, and if I've missed introducing you, I really apologize, and that doesn't mean that you're not important. It doesn't mean that we don't need you, because we certainly do. And we have refreshments. Oh, guess what? They're not cookies and cake. Fruits and vegetables all the way. So please stay and join us. Thank you all.